Many Pennsylvanians are drowning in medical debt, and it can be hard to get out of it. It's leaving some people to forego getting care altogether. Taylor Tosheff joins us now live from our newsroom with how lawmakers are working to change that. Taylor.
Valerie, it's estimated 1 million Pennsylvanians carry some amount of medical debt. State lawmakers called for ways to alleviate that. It's also a top priority for the governor, proposing millions in his budget to wipe it out. In 2019, Maggie Lynn of Delaware County was in a car accident,
which resulted in needing at least a year and a half of orthopedic and plastic surgeries to save my left arm.
The cost of that piled up.
This resulted in my amassing medical debt, although I did have insurance at the time. For me, it meant that I had a constant sense of just dread over my phone ringing because it would end up being a debt collector more often than not.
The sad reality is that in Pennsylvania, there's over 1 million people who have medical debt that is in collections.
State Rep Tarek Khan, a nurse practitioner, says people with mounting debt many times don't seek care.
What I see in my practice is reflective of what we see nationally, patients actually delaying seeking care because of medical debt.
The issue disproportionately affecting rural communities.
Hear me on this. The counties with the highest share of medical debt are Warren, Greene, Bradford, Franklin, and McKean.
In his budget address, Governor Josh Shapiro proposed dedicating $4 million for medical debt relief for low-income Pennsylvanians.
Hospitals then sell off this debt to collections agencies for really pennies on the dollar.
House Bill 78 wants to change that by creating the Pennsylvania Medical Debt Repayment Program.
The structure of this bill actually would allow medical debt to be bought at that process by the Commonwealth of Pennsylvania, where the Commonwealth is then able to cancel that medical debt.
House Republican spokesman Jason Gottesman says it's impossible to cancel debt.
The only thing you can do is transfer it, and in this case the proposal would transfer the existing medical debt, $4 million's worth, to taxpayers to pay off. So somebody's paying this debt.
In a statement, the Hospital Health Systems Association of Pennsylvania says it's neutral on House Bill 78, adding PA hospitals provided $752 million in uncompensated care in the 2020 fiscal year. And the House passed Bill 78 last spring. It's now sitting in the Senate committee. Live in the newsroom, Taylor Tosheff. Alicia, back to you.
Taylor, thank you so much.